How's your breathing been?
I was pretty bad off a couple years ago. The only time I went out of the house was to go to the doctor's.
Our approach is that we want to individualize this care. We do assessment and treatment at the bedside, but we also want to look at the patient to see how well they're taking care of themselves outside of the hospital. Do you remember how to do this? Deep breath in, big breath out, everything through the mouth. Oh. Good. It's very good. Look what you did. So we emphasize education and we emphasize follow-ups. We do follow-up phone calls. And then we also have a monthly free Better Breathers Club meeting that all patients are invited to come to.
All of it empowers the individual to have a better understanding of their disease and hopefully should lead to better outcomes down the road.
You feel like you're a person, you're not just another chart.
It's an indicator how much air you can actually blow out.
They're very good about explaining things to you and taking time. You don't feel like you're in and out, like hurry, I'm checking my watch.
That's where our team differs than a lot of care at the bedside, is because we're allowed to give that extra time to be with the patient and to talk to them.
As long as they understand the medications, how they're used, why they're used, when they're used, that element of medicine is often lost because it's so busy, right? And I think that to make that personalized for each individual patient can only empower them to better health care.
I feel like I can discuss back and forth the reasons why I don't want to do it, and they can tell me why they think I should do it. And then we come up with a plan instead of a dictatorship, like you're going to do this, and that's how it's going to be.
Linda is a wonderful example of how we use our tools to help other people. Linda is a character, and she is spunky, and she attends our meetings, and she follows what we try to teach her, and that's important. A lot of times Linda may be coming to our meetings a few minutes late, and she'll be rushing in the door, and she goes, "Oh, I'm so glad you taught me those breathing exercises because I was able to walk from the parking lot to the meeting."
That's the reason why we do this job. When somebody can follow through and have an impact where their quality of life is better and they just came back from a trip or a cruise or something, despite having respiratory limitations, and they had the greatest time of their life with their family, and it only makes us want to keep doing what we're doing.